Local 514 recently looked into the federal government delaying the expansion of eligibility for medical assistance in dying, while many groups and individuals continue to push for the current eligibility to be reviewed. Local 514's host, Savannah Craig, spoke with Cindy McKay, a board member of Les Habitations Adaptées et Accessibles de Tongo, as well as disability rights activist Alicia Ann Pold, journalist Jeremy Appel, Suzanne Desjardins of Dying with Dignity Canada, and Dr. George L'Espérance of l'Association québécoise pour le droit de mourir dans la dignité. Craig and the interviewees discussed MAID being sought as a result of individuals experiencing poverty, not being able to have access to housing, and the additional barriers people with disabilities face when trying to access these basic needs.
Title that I could use for you.
Jeremy Appel. I'm an independent journalist in Edmonton, Alberta.
Thank you so much. So could you tell me why you decided to write about MAID, in the past little while?
Well, it's an issue I've thought about a lot since I was young, since I was sort of developing my own political consciousness. It was always something that I thought was like a fundamental human right, like access to abortion and legalizing cannabis. Um, those types of things, and it was always no brainer to me as I write in my piece, like why would we deprive people of that right to end their lives on their own terms? The argument made by Dying with Dignity, right, which I still have a lot of sympathy for, but it becoming legal opened up a lot of questions that I hadn't considered before. And I think my long time perspective, which has changed a bit, was very much rooted in this sort of neoliberal framework where individual rights are sacrosanct, and which sort of obscures all the other social forces at play that are beyond people's control.
Thank you. Could you explain to me a little bit about eugenics and how this comes into play with the use of MAID?
Right. So, I mean, already there are so many examples, and these are just the examples that have been reported in media, of people with disabilities being offered MAID because their needs can't be provided for. I mean, I think the veterans who did so got a lot, who had that, had that offered to them, got a lot of media coverage. But there were also a lot of civilians who were offered MAID because disability support rates are low across the country to varying degrees. But for example, in Toronto, there's you get $1,228 a month for disability, 1,358 in Vancouver, and I mean you simply can't afford to live with those rates in those two major cities. And one example, there was a guy by the name of Sean Taggart who had Lou Gehrig's disease, a guy in Powell River, BC, and he decided to get medical assistance in dying in August 2019, because he needed to receive 24-hour care for his Lou Gehrig's disease, but the government only provided funding for 16 hours of the day, so 2/3 of the day, which meant he would have to pay $263.50 a day for the remaining 8 hours. He left behind an 11-year-old son, and he was given the option of becoming institutionalized, where he would have to live away from his son, and he called that a death sentence, right? And I mean, there are just so many examples of these types of tragic scenarios. There's a guy in London, Ontario, Roger Foley, who had degenerative brain disorder, and he recorded his conversations with hospital workers who had offered him MAID without him even asking about it. The hospital's director of ethics sort of warned him that continuing his care would cost more than $1,500 a day, which he, I think, correctly, in my view, regarded as an attempt to coerce him into just ending his life. And I mean, yeah, it goes on and on. And these are just, again, the instances that have been reported in the media. We obviously don't know how many have flown under the radar.
Thank you. How do you believe that we can offer MAID in Canadian society with, without upholding eugenics?
Well, I mean, first of all, is obviously a massive expansion of our public healthcare system to provide for everyone's needs, including those who are most vulnerable in society, including those with disabilities, including people with degenerative brain diseases or what have you. I mean, that's first and foremost, right? No one should be put in a position where they feel their life just isn't worth living. And but even barring that, which again I think is needs to be placed at the forefront, having a robust social safety net that allows everyone to live a life of dignity regardless of their ability is I mean is to look at other countries where MAID has been implemented, who have far more safeguards. In Belgium and the Netherlands, for example, doctors are required to have exhausted all options of treatment before they can even offer MAID. And those two countries also have a monthly commission to review potentially troubling cases. In Canada, I mean, we collect annual data on sort of who's being offered MAID or who's applying for MAID, who's getting accepted. There's sort of demographics, whether it's for a death that's reasonably foreseeable or not. But there isn't this sort of oversight where it's looking at, okay, well, what were the circumstances in all these cases, and which ones are we supposed to be concerned about? Another in the Australian province of Victoria, doctors aren't allowed to bring up MAID unless they're asked about it. So you don't get these sort of coercive scenarios where a hospital's director of ethics, of all people, is telling someone, well, it's going to cost a lot to keep you alive, so maybe you should die. And yeah, so I mean, there are safeguards for it, and they have various strengths. In Belgium, doctors are discouraged, but they're not outright prohibited from offering MAID, which I mean allows quite a bit of leeway. But again, there are these safeguards that exist, and it's puzzling to me why Canada didn't adopt those safeguards from the outset.
Thank you, Jeremy. Um, so, eligibility for MAID is expanding next month. Do you worry with more with the eligibility? Sorry, I can't think of the word. Are you
Is it
concerned?
expanding next month?
Yeah. Let me pull it up here.
Because I thought the government put that on hold.
Oh yeah.
Indefinitely, but I could be wrong.
Let me Google it quick.
You can cut this part, right?
Yeah. For sure.
Okay.
So 3 hours ago, under Canada's current MAID law, persons suffering solely from a mental illness who meet all eligibility criteria and for whom all applicable safeguards are met would be eligible for MAID as of March 17th, 2023. Yeah.
Actually, just from an hour ago, there's a report here from the CBC that says they're delaying a year.
Oh, okay. Thank you for pulling that up. Why is that not coming up for me? Okay, I gotta make a note of this. Thank you. Oh yeah. Okay, I see that now. Thank you for clarifying that. Well, I mean, with this in mind, like even though there is a delay, just the conversation over possible expansion of eligibility, I mean, does this cause concern for you that, it'll be an easier way out for those who are not supported within our society?
Yes, absolutely. Because again, unless in the next year the government like massively expands mental health care, which seems unlikely because the federal government has opted for all healthcare matters to say, "Oh, that's the province's problem, blame them." Which, conveniently, the vast majority of provinces are run by conservative governments. So then the liberals can run against the big bad conservatives. But yeah, no, it's absolutely concerning. And even if you look at specific cases, there was an individual in Toronto by the name of Alan Nichols who was institutionalized after having a suicidal episode from depression. While he was institutionalized, he asked his brother to bust him out of the hospital as soon as possible. A month later, he was accepted in his application for MAID, not for depression because that isn't legal yet, but for hearing loss that he got as a result of brain injury when he was 12. So I think that shows how flexible it is, and it leads me to believe that people are already applying for mental illness because the system has completely failed them, and doctors are and nurses are just looking for a way to justify it, because not through any fault of their own necessarily, but just because the system is ill-equipped to deal with people who have severe mental illness. In that case, the family filed a police report and got in touch with the health authorities because they were just puzzled. I mean, how was he eligible for MAID? How is hearing loss an applicable criteria? And it's also worth noting in that case that Mr. Nichols had refused to take his medication and use his cochlear implants, which would have helped for his hearing. So I think this is a clear example of the system failing someone with mental illness and just telling them, well, you can end your life. like that will put you out of your misery. But um, why is there such misery in our society? You have to ask.
Thank you. Um, do you, I know that you've touched on this, but I still want to ask, would you say that MAID is an easy solution for the government instead of addressing social health and mental, or better addressing and better providing access to social health and mental health services within our society?
Yeah, I mean, it's a lot more cost effective. As the ethics director at that hospital in London, Ontario, who was recorded saying, "Well, it's going to cost this amount of money for us to take care of you for this amount of time." Um, I mean, I think that was very revealing, right, of a mindset that is shared by people in positions of power. And it offloads responsibility from the public and our social support systems, I should say, onto individuals. And it's like, well, it's up to you. You can live with the hands you're given, or you can choose to die. And people are choosing the latter. And I mean, if you look at the data, which isn't that recent, a small percentage of people are opting for MAID whose deaths aren't reasonably foreseeable, but that's also growing, that percentage. And even then, if one person is being failed by the system and chooses to end their lives, which we know of a few examples of, then that tells you something about the system itself, and that one person could have been kept alive if they're being given the appropriate social supports.
What do you think that we can do in order to push the government to actually do something to put more funding towards these services and ultimately limit and, or maybe decrease instead of limit, but decrease the amount of people who are seeking MAID?
Well, that's a very good question, and I'm not sure I have an answer to that. I, I think that if you look at how, at least on municipal level, it seems the solutions to all our problems is just give police more funding, while every other social system just is constantly eroding. Suddenly, with police, when it comes time to fund the police, suddenly all these things like population growth and inflation need to be taken into account. Whereas with public health or education or all of these various systems, it's just like, oh, well, here's the same money we've been giving you for however long, if not less. Obviously varies from jurisdiction to jurisdiction, but I do think, especially with this push to invest more in police because of, you look at the transit safety issues in Toronto that are just being blared out by the media on a daily basis without asking questions about whether police would have actually made the situation better. Here in Edmonton, downtown Edmonton, a lot of the same framing and issues are taking place. And the solution is always, oh, well, just give police more money and have them have more officers around. And I realize I'm not answering your question, but I do think pointing out that disparity in questioning these authority systems that leave this like hollowed out public sector where like all the money gets sucked up by law enforcement. I think people through that I think people can sort of illustrate how badly we fail people suffering from mental health issues. Because I mean, if you look at all these instances, for example, of TTC violence that we're constantly hearing about, I mean, these were people who um, were at their wits end, right? I mean, pandemic like has been horrible for people's mental health. It's been horrible for people having housing, being able to afford shelter. And the solution that you can give more money to police and then give people the option of killing themselves is, I think, effective framing. But again, I'm not like a huge activist type, to be honest, although I am sympathetic to these movements. So I don't really have a great strategic plan beyond just pointing out like disparities and um, hypocrisy and the just emphasizing the imagery of all this. And since I brought up public transit, of course, investing in public transit is one uh, facet of our social support system that is always being cut. And it is much better for the functioning of society if everyone is able to get where they need to go in a timely manner. And also, there are various ways to make transit safer without police. And one of those is enhancing broader social support systems for people with mental illness, expanding housing, shaping sort of making like transit stations built so people are more like visible, because people are less likely to commit crime if it's in like a crowded area where there are other people who can intervene. How has no one brought up the option of having like mental health support workers on transit? Why is it always police? And I get I'm veering very much off topic, but I do think these conversations are all interconnected.
No, I appreciate that answer, especially because most of the work I'm doing right now is focused on the police budget. So I think it's
Well, I do know Montreal's police budget is out of control. There's a study. Did you see that study Ted Rutland did at Concordia?
Yeah, I'm doing a documentary on the police budget right now. So I just interviewed him last week, but yeah,
Oh, awesome.
I talk to Ted a lot. He does great work, but no, it's crazy. I've seen the recent stuff he's written on it. Yeah.
Yeah, well, especially just the Montreal police budget. They're essentially just setting their own budget in the city's just like, okay.
Yeah, pretty much. And they're the lowest paid, one of the lowest paid in the country.
The police force?
Yeah, that's something I came across this week. The police in Montreal are one of the lowest paid in the country, but they have the highest budget, and most of the budget goes towards their salaries. So it's like
that's really interesting. So they just have a lot more cops?
I don't even think so. I just started looking into this yesterday. And let me pull it up. There's not a crazy amount of cops. I haven't yet compared it to, like, I honestly suspect that Toronto's police force is probably a lot bigger.
Yeah. That's interesting, that contrast. Here in Edmonton, Edmonton increased its police budget by the least of all major cities since 2020, though the province is now pushing them to reverse that. So
Wow, interesting. Yeah, I just saw we have nearly 2,000 officers, which I'm not sure. I need something to put that into perspective, but yeah, just some funny info I came across. But no, I feel like that answer. I think it's a good answer. It's fair to bring up. That's mostly the questions I had. Is there anything else you wanted to mention? Or you think is
No, I don't think so. Yeah, I mean, I think the transit issue is a good example, sort of complementary example of how our social support systems fail, in that our solution, um, on the one hand, is to give people the individual freedom to kill themselves, but on the other hand, is using the strength of the state to police them more, and that's sort of this sort of neoliberal approach of just hollowing out the state and just giving people choice, um, to opt out of it all, versus this neoconservative law and order. We need to crack some skulls perspective is actually a lot of the work I've been doing lately with this book I'm working on, about someone who sort of exemplifies the intersection of those two approaches in many ways.
interesting. It's all interconnected.
Yeah, it is, but I feel like to a lot of people, you explain that and you just sound insane. It's like Charlie from It's Always Sunny in Philadelphia with the red string,
I always think of
talking about Pepe Sylvia.
that meme with he's pointing at the board, and I'm like, this is how I look.
Yeah. That's what I'm talking about.
Or I talk to my family. I'm like, this is how I look, and I know it's how I look, but I'm like, I don't care.
Yeah, well, yeah,
or at least ones that are anti-establishment.
yeah.
Perfect. Well, thank you so much for your time. It's been a pleasure speaking with you and hearing what's going on. I'll keep a lookout for your book, but I wish you the best of luck in finishing the writing.
Yeah, well, I'm going to need it. So thank you, and great to be here.
Wonderful. Thank you again. So I just sent
Dying with Dignity.
My name is Susan Desjardins, and I'm a board member with Dying with Dignity Canada and a volunteer with the Victoria chapter.
Thank you so much. So there's been stories in the media recently and, over the last little while about people who've been applying to MAID, and some have been approved, who are experiencing poverty or a lack of social supports and wanting to access MAID as a result of this. Do you have any initial kind of thoughts about this?
Well, I think we recognize as a society that there are tremendous gaps in supports for persons, financial supports, social supports, supports for individuals with mental illness. And this is an issue that needs to be addressed by provincial, territorial, and federal governments. Hopefully some of the discussions that are occurring now between ministers of health and premiers and the Prime Minister will move this in a positive direction. But I think we need to recognize that the lack of social supports is not necessarily linked to issues with assisted dying. It's a societal issue. Certainly there have been reports in the media of individuals who indicate that they are living in poverty, or perhaps are experiencing or are concerned about experiencing homelessness, and that they are looking to MAID as a possibility. But the lack of social supports or homelessness are not eligibility criteria for assisted dying. And I think that needs to be very clear. Some of these individuals may have medical conditions, whether they're physical or mental disorders, that would qualify them for assisted dying. But those are the things that would qualify them for assisted dying, not the fact that they are living in poverty or that, they may be experiencing homelessness.
Thank you so much for answering. I guess your last answer did kind of answer this, but I'm still going to ask anyway. Do you feel that requirements for MAID should be tightened, or that a review should be done to kind of avoid situations like this where someone may qualify for one reason, but they're seeking MAID as a result of poverty, things like this?
As an organization, we feel that the safeguards that are in place are very rigorous and do not need to be changed in the legislation. We certainly, as I said, feel very strongly that the government needs to improve access to palliative care to other types of care and supports that are required in the community. But there has already been quite a rigorous assessment of safeguards, and in particular, most recently, with respect to individuals with mental disorders. And a number of recommendations were made and submitted to the government last spring. And certainly those are being acted upon by committees that have been put together by the federal government and by organizations like the Canadian Association of MAID Assessors and Providers. But the consensus has been, certainly from clinicians working in this area, that the safeguards are sufficient.
Perfect. Thank you so much. Is there anything that I didn't ask that you would like to share or you think is important to consider with this topic?
Yes, I'm very concerned about some of the reports in the media, because I'm concerned that we are seeing a headline and perhaps getting a partial story in terms of the individuals and their circumstances. And clearly, private patient information is not going to be shared in the media. So oftentimes we read the headline, we make assumptions about what is going to occur or what may have occurred, and those assumptions may not be correct. And certainly, again, just to reiterate, in order to be eligible for an assisted death, you have to have a grievous and irremediable medical condition, disease, illness, or disability. You have to be in a state of irreversible decline, and you have to be experiencing suffering that is intolerable to you. So there may be circumstances in which individuals that meet those eligibility requirements may be approved for assisted dying. They may also be individuals who are homeless or who are living in poverty, but they are not qualifying because of their social or financial circumstances.
Thank you so much for your time. I really appreciate it, and it's been a pleasure.
You're very welcome, Savannah, and good for you to be working in this area.
So my name is Allie. I go by she, her pronouns, and I am a sociology and sexuality studies graduate from Concordia. And I'm also a content creator and disability educator.
Wonderful. Thank you so much. I know that Ode had referred to you as Alicia Ann. Do you prefer Allie instead?
I go by either or.
Okay, wonderful. So what, if you're willing to speak about this, what has your reaction been to hearing the case in Montreal, as well as elsewhere in Canada, where people with disabilities are seeking MAID as a result to not having proper at-home care, government services or being able to access proper housing?
Yeah, I mean, the change that happened in regards to Bill C-7 is something that I'd been aware of before the law was officially passed. So when it was still being discussed, before the Canadian government really kind of sat down to decide whether or not the bill would be passed. And then, as a lot of us suspected, it did pass. I guess maybe I can give a bit more context if people aren't aware, but medical assistance in dying has been legal in Canada in some form since 2016, if I'm correct. However, the way that it was instaured into law at that time was that people needed to be in very intense physical pain that cannot be alleviated in any way, and also there had to be a case of imminent death. So people who were in pain, physical pain, who knew they would pass away fairly soon. And so it was a way for them to kind of have more ownership on the moment that would happen, be able to be with the people that they love, etc. And then in 2021, if I'm correct, if I'm remembering the date right, the factor of having to be in a situation of imminent death was revoked, meaning that you don't need to, whatever you have, illness, disease, doesn't have to eventually kill you for you to apply for MAID. And that also included any or most illnesses and disabilities that are considered to be degenerative, progressive. And so what ended up happening is that a lot of people with disabilities that are progressive, with chronic illnesses, and also a lot of people with incurable disabilities ended up reaching out for MAID since then. And right now there are even discussions about including in that mental disabilities. So when it comes to mental illnesses, depression, anxiety, things like that. So obviously, that is a big portion of the disabled community in Canada, and therefore a lot of people have been reaching out to have access to assisted suicide. But, obviously one of the issues with that is that the support to help people not have to reach out for this option is very hard to get to, and sometimes just inexistent. And so one cannot really take an enlightened decision when you're not given any other option, basically.
Thank you so much for explaining this. I know that you already answered a bit of this, but just to kind of clarify further, do you think this speaks to the fact that people who are living with disabilities are not supported in our society and not provided with accessible enough services and spaces?
I mean, yeah, definitely. I think MAID is being used as the final solution, and instead of addressing the severe, I don't even want to say cracks, because I feel like that implies that, this is an accident, whereas it's very purposeful. But yeah, it's being used so that we don't have to address the very clear the fact that the government does not provide enough support, that our healthcare system has severe blind spots, that anytime we discuss things like the housing crisis, we aren't acknowledging a portion of the population. I often say that there is definitely a housing crisis for able-bodied people, but if people only knew how much more intense that is for people who have reduced mobility and who cannot physically get into the majority of the housing available in this city and all across Canada, people would be shocked. I think there's a lot of things that should be done. Accessible housing should be the norm, not the exception. And because we obviously cannot do that overnight, I think a lot of funds should be allocated to disabled people for them to be able to renovate their homes, their apartments. It should be illegal for landlords to refuse accommodations that allow people to live independently and safely, in their apartments. I think it's all these sorts of things that should be done that aren't being done. And obviously people are pushed to, over the edge because no other solutions are offered to them.
When you mentioned, sorry, I'm looking for the exact word, but you said something along blind spots in our healthcare system. Would you be willing to highlight a few examples?
Yeah, I mean, the fact that in order to have some accommodations paid in your apartment, in order to have a mobility aid, so like something like a wheelchair or a manual or motorized, even like a cane, a walker. If you want those things to be paid by the government, you need to go through the healthcare system. You need to go through medical professionals, and consultations to see those people take months. It's impossible to see anyone under 6 months, and then it's sometimes another 6 months to have those things. For accommodations, it's a little bit shorter depending on what it is, but we're still talking around 2 months minimum. And again, it's not just having the people come into your house and add grab bars in your bathroom. You need to have someone who can attest that that's really something that you need, even if it's obviously very obvious that you do. And again, it's because there's not a lot of people working those jobs. But I would say also just because we are very much so gatekeeping those types of resources, I think it's ridiculous that an able-bodied person that I don't know, who knows nothing about me other than like my diagnosis, has to come into my home to just look at my bathroom and be like, yeah, you would need a couple grab bars in here. Like, of course I do. But I need you to validate the needs that my body has in order for me to have this for free. And then obviously what ends up happening, and this is what happened to me as well, but we have to pay out of pocket for those things to be done, because we can't just stay 2 months without showering or without using our toilet. So we have to pay all of that out of pocket, and then there's no way to get that money back. So yeah, I would say that's definitely one of the blind spots. I mean, we can also talk about how trying to see a psychiatrist in the public system takes years. Same thing for things like physiotherapy and things like that. So yeah, those are what I'm referring to when I say blind spots.
Thank you for explaining. I was speaking with someone earlier today who is a board member and also lives in social housing. It's called Les Habitations Tango, and it's subsidized housing. It's made to essentially be accessible for people who are living with a range of disabilities, and subsidized, so mostly paid for by the government. Do you think that housing like this should be better accessible, or possibly even completely subsidized by the government as a way to kind of deal with, I guess, just like systemic issues in people living with disabilities not being able to find accessible housing, especially as the housing crisis gets worse and worse?
Yeah, I mean, I know there's certain like living co-ops or things like that in Montreal, but the wait list can sometimes be literally like 10 years. And obviously that's unacceptable. I think having more of those is essential for disabled and able-bodied people alike. But obviously those should all be accessible. And I think it's important, and that's something I say all the time as well, is that especially when it comes to like physical accessibility, it's important to see accessibility as an investment and as an always evolving project that we take on. I think having inaccessible buildings that we just look at and are like, okay, well, we're never gonna spend any time trying to, make these places more accessible, and we'll focus on making the new stuff accessible, is not the best way to go about it. First of all, because there's not enough space, and we can't just ask disabled people to move in the middle of nowhere. We need to make those changes now. And in terms of having it, financially accessible as well. Having brand new condos downtown with elevators and automatic doors is very cute, but the majority of us cannot afford to live in those buildings. And so I think financial accessibility and physical accessibility need to go hand in hand, and we need to, again, make those types of building the norm and not the exception to the rule.
Thank you so much. Is there anything, outside of improving healthcare, improving housing, social services that maybe you I guess kind of want to discuss, or just in general, anything that I didn't ask that you think is important to say or for me to consider when putting this story together?
I mean, I think it's important to, when we're talking about MAID, to not focus too long on the overall question of whether or not we are for or against assisted suicide, because I think we're way past that. And I think some people are just going to agree, some people are just going to disagree. But I think it's important to frame it as exactly what it is, which is that we're not allowing disabled people to thrive and to grow old in Canada anymore. With a law like that, and without proper support, medical, social, financial, this is a decision that is being taken for us. And like I said at the beginning, like, nobody can make an enlightened decision about this topic if we're not providing people with options. I think it's also important to just deconstruct our idea of what it means to, be a disabled person, and realize that being disabled doesn't mean that you have a bad life. You can have a fulfilled and happy life as a disabled person. But it is true that in Canada, we are doing everything for that to be impossible. And I think that's what needs to change first before we can, in large, requirements, or I guess shrink requirements in order for people to have access to MAID. So yeah, it's about not focusing on the bigger picture, but being honest with ourselves and think about the fact that Canadian society is not giving disabled people the tools required for us to have a real conversation about medical assistance in dying.
Les habitations Tango.
My name is Cindy McKay, and I'm a tenant at Tango as well as the vice president of the board of Tango.
Wonderful. So could you tell me a little bit about Tango and the work that you do to, help it run?
Well, Tango is a nonprofit housing, a small residence for 15 tenants. It's a service for people with disabilities who are autonomous but yet still need assistance. We have staff who help us on a daily basis. We have meals provided to us. We eat as a community. It's a community environment, so we all eat together. We have our own apartments, but we eat together, and we become, kind of friends with each other. And Tango is also a place where we're encouraged to join the community, which meaning, to not stay in our apartments all day. We're encouraged to go out at least 3 times a week to be part of to be part of society. And it's also low-income housing, so it's 25% of our income that we make goes into Tango, as well as the food service. And yeah, that's it basically.
Wonderful, thank you. How long have you been living at Tango, and how long have you been on the board?
I've been living at Tango for maybe about 10 years now, a little more than that, I don't remember. And I've been on the board for, off and on for about 3 or 4 years.
Thank you. And, oh, sorry, did you have more to add?
No.
Okay, perfect. So part of tenants partially, I guess, provide funds towards housing, and meal plan, as you said, but is the rest government subsidized, and is it the provincial government?
It's the provincial government subsidized, yes.
And has the time you've been since you've been living at Tango, has this funding provided by the provincial government changed in any ways, increased, decreased type of thing?
Not from my knowledge, no.
Do you think that more funding should be provided, maybe to help, provide more space for other possible tenants, or just anything you'd like to mention where the services could be improved by more funding?
Well, like I said, as far as the more tenants go, No, it's only 15 apartments, so that Tango's very small that way. But I think more funding can be helpful, as in terms of giving more to the staff and and also for the board to be able to function and provide, maybe provide more services. But Tango is mainly, like I said, to be independent on your own. So it's not an institution. So therefore, we don't have, like, for example, classes here or anything. It's just us being on our own and just being able to live independently and be part of society.
Thank you. I guess maybe something else I want to ask about that is, do you think that, outside of Tango, outside of these 15 apartments, just in Montreal or Quebec in general, do you believe that there should be more subsidized housing similar to Tango?
Absolutely. I've heard of people looking for places like Tango, and we are very unique to some of the other residences. We're very different in the sense that we have, like I said, we have our food services, we have even laundry services, cleaning our apartments, and a lot of places, from what I've heard, don't have that kind of service. So I think, yeah, it's needed more in here in Montreal, for sure.
Would you say that the general housing system in Montreal is not quite supportive and set up for it to be easy for those living with disabilities to find something that's, both affordable but both accessible to their needs?
Right. It's like I said, there's a lot of people who require a place like Tango, and so it would be beneficial to have more places like Tango.
Thank you. Just taking a scan at my questions. I guess, would you mind explaining, for those who are interested in applying to live at Tango, how does this process look like? What do they have to do?
They would have to first ask their social workers about Tango. Unfortunately, we're not that known, but we're working on getting ourselves more out there. But one of the two things that they can do is ask your social worker, or inquire at the OMHM, which is the Municipal Housing Project. They have the list of all the housing for low income and for people with living with mobility issues, they would be more, they would be able to tell you more.
Wonderful. Thank you so much.
Well,
Would you say that there's anything that kind of should go beyond providing more housing in, Montreal or Quebec society, in order to allow people living with disabilities to be more independent and also just feel more supported?
yes. There's a lot of businesses and a lot of buildings, government buildings. Well, they're becoming more and more accessible, but there's still a lot of department stores, regular, independent stores that are not accessible, but also a lot of people's ideas of accessibility are different than what should be. I'll give you an example. I was at a shopping mall, and even though there's a sign saying that it's accessible, it really, like, you could just fit in there. A person in a wheelchair or using a walker can just fit in there. So the idea of accessibility, has to be, you can't get someone, you have to understand what we need before making these places, to consult with us, to make it more accessible for us, because just saying that we put a sticker on the door saying that it's accessible, no. You have to make it more accessible. You have to, be with somebody who needs the services in order to know how to make the services fit for them. I don't know if I answered your question. No, okay.
No, you did. Thank you so much. Just taking notes.
Okay. Sorry, that was my phone.
No worries. Take your time.
Okay.
If you're willing to discuss this, before you found Tango, what was your experience like finding housing? Was it difficult? Did you live in another space similar to Tango?
No, before I moved to Tango, I was living with my parents. And and because I'm the only person in my family who has a disability, the house that I lived in, the duplex that I lived in, wasn't accessible to me. I mean, I was able to get around because I was used to the environment, and then the only other thing was we were on the second floor of a duplex, so there were stairs to walk up and down, which I was able to do, but it started getting a little more difficult because my body was, not, as you get older, your body gets, especially when you have a disability, your body gets older than you are. So, but when I found Tango, and I saw that there was an elevator, I saw that the spaces were big enough that it helped me to become more independent, because the energy that I was using before, walking up and down those stairs, I didn't have to use that energy. I could use it for, you know, being part of society, going out, you know, being with my friends. You know, it helped me in that way to move here to Tango.
I'm glad to hear that. I'm glad to hear you found Tango.
Thank you.
And I just wanted to ask if you're willing to talk about this as well. You know, when you hear cases in the news of people living with disabilities who don't feel supported and are maybe considering things like MAID, you know, how does that make you feel? And does it make you feel like our society is just not, or I guess these cases kind of highlight how our society is not providing enough support or the right support?
It does get me upset, but I would want, first of all, I want the society to recognize that we're here. You know, we need your support. You know, we need you to work with us. And also, if a person is requiring services and they're not getting it, don't just sit back and accept it. Call your city officials. Call people. Tell them what you need. And because it's for a long time, that's what we were doing. We were just, you know, people with disabilities were just sitting back and letting society tell us what you know, tell us, well, not tell us, but I would say letting society just figure out what we want and figure out what we needed. We have to turn that around and say, no, this is what we need. You know, so I would, and that's why I wanted to, you know, I'm trying to meet, you know, like I'm meeting with you. I want to talk about, you know, what we need. And more people with disabilities should be doing that, saying what we need, because we are part of society.
Thank you so much for sharing that.
You're welcome.
Is there anything that I didn't ask that you would like to share or that you think is important that I consider when putting this story together?
Just again to, you know, get the government more involved, get people more involved with helping us and educating people. You know, like, again, like I said before, you know, some people's ideas of accessibility is not very, very wide. And so we need to be, you know, it needs to be it needs to be talked about. You know, we need to talk about what people with disabilities need, and we need to act on it.
Thank you so much for your time today. It's been such a
your position at AQMDM.
My name is Georges L'Espérance. I'm a neurosurgeon. I'm president of the Association québécoise pour le droit de mourir dans la dignité.
Thank you so much. So, why is the right to medical assistance in dying essential?
Nice question. Because it's broadening or casting the autonomy of the patient. So a patient with a disease and who answer to all the to all the criteria of the law, which means a disease that is not curable, and also that the patient is going to the is not able to cope with it anymore. He's able to decide for himself what will be his end. Not because he wants to, but because there's no answer to his disease, and there's no answer neither to the end of his life, to the quality of his life, to the meaning of his life. So it's essentially the autonomy of the patient and the respect, of course, of the patient.
Thank you for answering that. There's been a few cases of people who are requesting MAID as a result of, some living with disabilities. They're not able to find access to safe housing. Some others are experiencing poverty. Just a few examples of cases where it's not, some of the things that you had mentioned, they're not experiencing intolerable pain, things like this. It's just unfortunately they are facing inequalities within our society, which prevents them from accessing proper human rights. Do you think that these cases should be able to access MAID?
Well, to my knowledge, there has been few or even not any case in Quebec. I know that there has been some cases in Canada and the rest of Canada, but it's very, very few persons. The other thing is that the only reason loneliness or poverty is really not a reason to have MAID, and I don't think, but I can speak only for me and my colleagues that I know a little bit better, and the colleagues in the Quebec region, in the province. But I don't think they would accept it. If the patient has a disease with poverty or a disease with important illness, well, that's another ballgame, if I can say that. The patient has the right to be evaluated, and then we can see if there is any reason to get MAID. But frankly, what I can see of my colleagues, what I can see of all the people I got on phone, or because I got a lot of phone from people around the province, I don't think that those people will be accepted, will be allowed to have MAID. That's my impression. If the only reason is handicap, with no possibility of being helped, I don't think it's a reason. If the person has a handicap which is incurable and which also that person got a lot of help, but that this person doesn't want to live that way anymore, well, I think it's reasonable to evaluate that person, and then if she answers to all the criteria, then proceed with MAID. But it's really a problem of evaluation of the patient, a long evaluation, and to see all the impact that the person has. Poverty is surely not a reason, that's for sure, even if it's sad for that person. If there's a disease with that, it's another problem.
For cases, outside Quebec and Canada, such as, a few months ago, there was a case in the news about veterans experiencing PTSD, and someone had recommended I think I need to pull up the exact name. It was Veterans Affairs Canada caseworker had recommended that they should look into or think about MAID when they had the veterans themselves had never brought it up. Do you think in cases such as this or in cases outside Quebec where people are experiencing poverty and are being accepted for MAID, do you think that Canada should kind of tighten the eligibility for people to seek MAID?
Well, frankly, I think that the rules are pretty clear, and also that there must be some guidelines, clinical guidelines for the doctors and for the nurses elsewhere in Canada to cope with that. Each case is a particular case. Each case is special, and we have to look at that with compassion, with empathy, and to really look at the whole picture. Well, for example, PTSD is a mental disease, if we can say that. It's a mental health problem. If PTSD is really new, let's see, for example, 1 year. Well, I don't think it's good for MAID, even if the law is allowed to mental disease processing to MAID. But if the PTSD is going very worse for, let's see, for example, 10 years or 15 years, and all the treatments have been non-effective, well, when the law will be passed for mental disease, I think that that person could get it. But there's always, every person is different, and we have to look at every person as a whole individual, and that we have to look at all the individual. But just telling that, well, is that disease is allowed to have MAID, except for cancer, we can say no. We have to look at the patient on the whole. If there's a cancer, untreatable, incurable, well, we know the answer. But for all the other things, we have to look at the person as an individual and not as a diagnosis or not as a social situation.
Thank you. In Belgium, for example, with MAID, doctors are required to exhaust all other options of treatments until they can even consider MAID. Do you think that something like this should be upheld in Canada?
No, because it goes against the Charte des droits, Charts of Rights. Nobody in Canada is you have the obligation to have any kind of treatment if that person doesn't want it. So it's the law, it's the Charter of Rights, and always we're going to the same thing. It answers to the respect of the person, of the autonomy of the person. If I don't want any treatment for, let's say, for example, cancer, that's my own choice. That's it. And we have to respect that. But we have also to be sure as a clinician that the person understand all what we're her situation and what the medicine has to offer, and what is the prognosis of the treatments of that disease with the treatments. So when we're sure that that person and perhaps the family around understand well the situation well, the person is allowed to do her own choice. But I don't think we have to oblige any people to go to any kind of treatment. That wouldn't be a respect of the autonomy of the person, if that person is apt to decide for herself, of course.
Thank you. Is there anything that I didn't ask that you would like to share or you think is important in the discussion over MAID?
Well, I think I can just repeat, as clinicians, as providers of MAID, we have to look at the person as a whole. We don't look at the person as a diagnostic. We don't look at the person as a social individual with rich or going in poverty. We have to look at the person in his whole picture, social, medical, family, etc., etc. So that's the way to do MAID, and so we have to listen to that person, and we have to try to be at her place. And I think it's medicine. That's it.